everyone, this is Marika and I welcome you all to this new session of nursing management. So in our previous session, as we started with the third unit, we have discussed what is a hospital and what are the several objectives of any hospital. We have seen in our previous class that a hospital is also considered as a rest house for sick people, which means a hospital is a place where people with certain illness, certain health needs come for a particular treatment. The treatment or the care that is needed by the people is provided by various medical staff to the people in order to overcome their illness and to maintain their health. Now, we have also seen that nurses plays a major role in providing care to the patient, as nurses are of the medical profession who is always with the patient, providing the care needed by the patient. We also discussed that a hospital should always have three major things in order to run it as an organization, which includes manpower, which also includes money and materials. So these are the major things that are required in order to run a hospital. The manpower in the hospital involves all the staffs who are working for the functioning of the organization, such as doctors, nurses, class 4 workers, and various other medical professionals. The materials that are required in the hospital includes all the instruments and equipments that are used in order to perform certain procedures on the patient, on the sick people, whether it is a major procedure or a minor procedure. And finally, we have money or funding, which is one of the most important part to run any organization as well as to run the hospital. To run any organization, to run hospital as an organization, we require manpower, we require money and also material. Along with that, we also require a proper management system. Now, in our previous session, we've already seen what is a hospital, different definitions of the hospital, and we've also discussed about the 12 major objectives of the hospital. In this session today, we are going to see the scope of hospital. The scope of hospital or hospital care is vast, as we are already aware about it. But there are major 6 different scopes of the hospital. We will discuss in detail one by one. But first, let me list out the 6 different scopes of hospital. The very first one is coordinated health team approach. In any hospital, we see that the health team coordinate with one another in order to run a hospital properly or in order to deliver their services properly. The second scope of any hospital is holistic care. So we have already discussed in the objective, the very first objective of the hospital is to deliver care, a quality standard care to all the people in need. The third scope of the hospital is comprehensive or specialized care. The fourth scope is integrated care. The fifth one is evidence-based care, or we can also call it as research-based care. And finally, the last scope of hospital is continuous care. So these are the 6 different scope of hospital. Let us see in detail one by one. We have seen the very first one is coordinated health team approach. Now we all have been to the hospital as patient and also as student nurses. And we've also seen how a hospital functions. Even for one particular illness, no matter whether it is a doctor, it is a nurse, whether it is other medical professionals, it is not possible to meet the health need of even one single individual by one of the medical profession. So, an individual healthcare worker will not be able to meet the health need of any of the patient, which means a combined effort of all the health team members is required in order to meet the health need of each and every individual patient in the hospital. So there needs to be unity among the doctors, the nurses, other medical professionals, as well as class 4 workers who are working as a team in order to meet the health need of each and every patient. Now, when we think about hospital and when we take one individual who is suffering from certain illness, it is not just the doctors who go and treat them. It is not just the nurse who comes in contact with the patient or to provide care to the patient. It includes doctors, it includes nurses, nurses, pharmacists, dietitian, as well as paramedical staff. So all of these members are working towards achieving patient satisfaction, or we can say that to provide a quality care to the patient. Therefore, it is required to have a proper combined effort in order to meet the health needs of the patient. The second scope of hospital is holistic care. So what does holistic care means? Holistic care is providing not just physical care to the patient who have physical illness, but also taking care of their physiological, psychological, spiritual, and sociological aspects. So to provide care to the patient, even if the patient comes with a physical disability, even if the patient comes with a physical illness, holistic care must be provided by the staffs of the hospital. Now, holistic care not only includes helping the patient to overcome the physical disease, but helping the patient in terms of spiritual, psychological, physiological, as well as sociological aspect. Why is it required to provide holistic care to the patient? The patient has a physical illness. Why cannot we just treat the physical illness? And why do we have to involve other aspects for the patient? Because holistic care will help the patient to overcome his physical illness, as well as it will help him to shorten the stay in the hospital, ensures patient satisfaction, and ultimately it will ensure that the quality care is provided to the patient. So a person, even if he is suffering from a physical illness, there are various other things that affects the health of the person. If we are mentally not happy, then our physical health is also not good. So to be considered as a healthy individual, we have to be physically fit as well as mentally healthy. Our spiritual aspect, our psychological aspect also has to be good. Therefore, in hospital, holistic care is provided in order to help the patient restore their health. The next scope of the hospital is comprehensive care. Now, what is a comprehensive care? A comprehensive care is a care that is provided in order to promote the health of the individual, in order to maintain the health of the individual, as well as prevent various illnesses and complication. Now, we've heard of various specialty clinic, for example, neurology clinic or a medical adult clinic. All of these specialized clinics are open in order to provide a comprehensive care to the patient suffering from a particular disease. The next scope of hospital is to provide integrated care. So again, similar to comprehensive care, similar to holistic care, hospitals aim to provide an integrated care to both ambulatory patient as well as non-ambulatory patient. Now, ambulatory patients are those patients who are able to perform certain physical activities, who are able to move on their own, and non-ambulatory patients are the patient who cannot move or who are not able to perform any kind of physical activities. The next scope of the hospital is one of the most important scope, and also it is one of the most important in our field. The next scope that we are going to discuss is evidence-based care. Now, evidence-based care can also be termed as research-based care. As the term suggests, research-based care or evidence-based care is a care that is provided to the patient after conducting the research and after seeing the results. So we know that in evidence-based care, we find out a problem, we see a practical problem that is faced by the patient during their hospital stay, and as the problem is identified, the researcher tries to find out what can be done in order to solve that problem. So the researcher conducts the research, the researcher performs certain experiments and see what is the best possible solution that is available for the particular problem. There can be many different options to choose from. As a researcher, when I conduct experiment, I may find many different possible solutions. All of these solutions are tried, all of these solutions are explored, and then finally the best one is picked out for the problem that has been diagnosed. So this entire process helps the researcher to understand the problem in detail, to understand what is the exact problem, and it will also help the researcher to find different solutions. From different solutions that has been found, the researcher chooses the best one and applies it for the particular problem. And if this chosen option helps the patient, then it is implemented in day-to-day care of the particular illness. But if the chosen solution does not help, the researcher will have various different other possible solutions, and therefore the researcher can experiment with those solutions. So evidence-based care, as I told, is a research-based care. In evidence-based care, the researcher will find out a practical problem that is faced by the patient during their time of hospital stay. Once the researcher identifies the problem, the researcher sees what is causing the problem, understands, and then the researcher tries to generate various possible solutions for the problem that has been diagnosed. Once various possible solutions are formulated, the researcher experiments those solutions. The researcher tries those solutions in order to solve the problem. From different solutions that has been generated, the researcher will finally take the best solution and then implement it to the patients. And if the chosen solution is not helping the patient to overcome the problem, there are other various possible solutions that a researcher has generated, and therefore the researcher can take each of those solutions and experiment it on the patient to see if it is helping the patient. Now, we should also understand why is evidence-based care necessary. When we conduct research, only then we will be able to find out the best solution. Therefore, when a researcher conducts the research on the patient, tries to understand the problem and finds the best solution, the quality of the care that is provided to the patient also increases, the standard of nursing care also increases. And finally, the last scope of hospital is continuous care. Now again, from the term itself, we can understand that this means the care that is provided to the individual is continuous in nature. Hospital is such an organization which is open all the time for each and every individual in health needs. And the care that is provided in the hospital is also continuous. So hospital is considered as an agency that is open for every individual in health needs, and they provide continuous care to the patient who are in need of health care. So these are the various 6 scopes of hospital. I hope you've understood today's topic. To conclude, today we have discussed about hospital. We've seen that hospital is a place where medical facilities are provided to sick individuals in order to help them overcome their illness. Hospital is also a rest house for sick people wherein various different medical professionals come together in order to provide care to the patient. And nursing department is one of the most important wing in the hospital. And then moving on, we also discussed about the various different scope of hospital, wherein we have seen there are 6 major scope of hospital, which includes coordinated health team approach, holistic care, evidence-based care, continuous care, specialized care, and integrated care. And then we discussed in detail about the 6 different scopes of hospital. I hope the class was helpful, and I'll see you all in the next session where we will discuss about organization and functioning of the hospital. So in our next session, we will be discussing about the different departments that are available in the hospital. What are the different departments that work in collaboration in order to run the hospital? Thank you and have a great day ahead.